Hello, and thank you for tuning in to Answers from the Lab, where we share Mayo Clinic knowledge and advancements on the state of testing and science from laboratory leaders and the people who are making it happen behind the scenes. I'm Dr. Bobbi Pritt, Interim Chair of the Department of Laboratory Medicine and Pathology at Mayo Clinic in Rochester, Minnesota. With me today is Dr. Bill Morice, the President and CEO of Mayo Clinic Laboratories.
Hi, Bill. Welcome back.
Yeah, as always, good to be here.
Yeah, another week, another great time to talk about what's going on in our specialty. And you just got back from Washington, D.C., the ACLA annual meeting. I bet you have some hot updates for us.
Yeah, well, I have updates for sure. I guess hot's a matter of perspective, but there's certainly a lot going on. I was out there actually almost for the full week in Washington, D.C. It was beautiful weather. It was like in the 70s, and that's like one of my favorite cities. It's a great city to go for a walk or a jog, because we go out on the mall, and it was great. And I did a few things out there. Actually, my first thing I got a chance to visit our Representative Emmers from Minnesota, who's actually the majority whip in the House. So I got to visit the Capitol building for the first time, which was really cool,
Excellent.
and talk to and be in the majority whip's office for the House. A few things that were really interesting about that. Number one is they have a clock running about showing the next when they have to have the next deal done to continue funding for the government, and discretionary funding or whatever that is. It's at and there's only was 9 days on that clock, and so that was one of the points that was made to us by Representative Emmer's office, is just that they're still kind of embroiled in the work of really what should have been 2023 in terms of 2024 budgetary stuff, which is a bit, disconcerting, because that means that it makes it more and more difficult to focus on new legislation, right? Although there's a lot of interest in healthcare, in President Biden's, plan, there was a lot of healthcare stuff. There's a lot of interest in Congress in getting legislation passed around healthcare, which is good for us, and still a lot of support around SALSA. But that was the first thing, just to note, was just that how much is the Congress has going on right now. So that was, I think, one thing for all of us. Again, it was reiterated around SALSA, and getting an alternative to PAMA beyond just delaying PAMA cuts. It's going to really take a good advocacy, because people, everyone you talk to on, bipartisan, so on both sides, really is supportive of doing something more, that would be more, make the labs, kind of give us some security going forward and what that's going to look like, not the uncertainty of our PAMA cuts going to come and they're, how big they would be. But, there's so many competing priorities in Congress, and especially something that has to get paid for in some way, shape, or form, that really the advocacy groups, there's, stop lab cuts that on the ACLA side. I'm sure other professional societies have stuff just for people to stay engaged on that, as you and I have talked about in the past.
Yeah, along those lines, Bill, I'll just mention, of course, I'm heavily involved with the College of American Pathologists, CAP. They are also very active in this space. And in fact, there's a CAP Pathologist Leadership Summit coming up in April 13th to the 16th. And that's an opportunity for pathologists to go and meet their representatives and advocate on these same issues. So I'll put a plug in for that. I'll be there. And it's fun to go to the White House and actually be on the campus, and then go in and meet with your representatives and their assistants and really talk about the issues that are important to us. And that's something that anyone can do. So it's open, coming up soon.
That's great. And I think I will say, there just makes a difference when you're there in person. Even Zoom. I did a lot of Zoom meetings for advocacy with the federal government during COVID. It doesn't have the same impact a lot of times, because you have to, work with the staff for our congressional representatives, and so for them to really understand it and have a little more time with you, just be able to ask questions. There are some really smart people that are supporting our representatives that want to understand the issues. So that's great. I think people going in person really going to help. The other thing so in terms of other topics of interest while we were there, there's a few, even on the payment side, beyond SALSA, and PAMA, which of course we've talked about a lot. There's actually a real interest. I got a chance to meet with John Blum as part of the ACLA, American Clinical Laboratory Association board, the chief operating officer for CMS, so like one of the highest ranking people at CMS. They are very interested and are actually issuing policy around prior authorization and trying to make it simpler or to remove it altogether for certain things. And I mean, that can be a real problem for us in the lab, right? Particularly
Yeah.
around genetic testing and other things where, prior authorization, it puts us in the uncomfortable position of having a specimen and either running that test and not knowing if we're going to be able to actually get paid for the test, or we're going to be giving the patient a bill, versus waiting and trying to sort through prior auth, because a lot of times what they need or want or request is not information we have access to. They want it directly from the physician. They don't accept things that are on the test request document, all those sorts of things. He listened, and it was a chance to explain that, when I think the challenge with labs is that we always are different, right? So if you're ordering a radiologic procedure, the prior auth process is cumbersome, but at least it makes sense with the workflow, because you have to leave that office and then go someplace else to get the diagnostic, service that you're looking for, or that the physician has ordered. With a test, you're going to get drawn right there, and it's going to go. And so we've got a chance to really explain the workflows and how it's really a barrier for patients to get access to the care that their physicians want them to have and that they need to receive. And they were very receptive. So I think, man, that's another area. If we could get, you and I have talked about this a lot, particularly during your time as serving as DLMP chair. I mean, it's a big issue for labs. So that was really gratifying to hear that there might be traction there.
Yeah, that's such a huge issue, and it's something we really do need to partner with our colleagues that are ordering the test to make sure it's in the workflow seamlessly. It's important that our patients aren't stuck with a big bill, but at the same time, we need to be able to understand the process and make it easy to get prior authorization and hopefully get approval from the insurance companies.
Yep, exactly. And then last but not least, there's certainly not least, there's a whole discussion around coding, something we don't think
Mm,
about a lot. There's a lot of people that because it can be very detail oriented work, but the reality is that, either some of the payers like the MACs, the Medicare administrative contractors that actually, do the billing for Medicare, don't recognize things like PLA codes, or there's
yeah,
variability, and so that's also being addressed. So there's a lot of really good things
good.
happening, I guess, is the bottom line on that, which is super important for us. It's hard enough to keep the lab sustainable, but we really need to be getting paid properly for the work that we do. So that was really good to hear that there's interest in the federal government in actually working on that. The other thing, of course, was there was a lot of discussion around FDA, as you can
Yeah,
imagine.
sure, of course. And
So,
we're still waiting to hear for the final rule, but it's all in the works, moving along.
yep, it's at OMB. No one can really, no one, when now it's completely embargoed. So no one knows what exactly is in it. In terms of reading the tea leaves, if you will, is the fact that it got to the OMB so quickly means that they, suggest that they might not have made a whole lot of changes from the proposed rule to the final rule, but we won't know until we see. And I think as we talked about last time, there's a window, that they want to get the final rule published, and part of the public record, and it's something I didn't understand until recently. It's a function in Congress saying that if agencies, issue a new rule within 6 months of a new Congress, the new Congress can then actually
Right.
unilaterally rescind those rules. I think it's a way of, prevent agencies from putting a lot of stuff in place kind of in a lame duck. So the pressure's on for them to get that out. So we'll see. My gut is it's going to come out in April.
Mhm.
It is possible at the last minute that there's, someone within the White House might get cold feet because of some stakeholder groups, but it's really everyone's really gearing up for that. Though it does feel when you're out there, and this is not really much more qualitative than quantitative, if you will, but it really feels like it's going to happen this time. It's something
Yeah.
we've talked about for at least 15 years, but it kind of fills you with gives you a little bit of knot in your stomach, just because it really just feels like it's going to happen.
Yeah. And it's hard to prepare until we know what is exactly in the final rule,
Yep, exactly. So we'll
whether
just
there's things like grandfathering, any other potential clauses, and how it's going to be enacted. So we will keep everyone up to date as we hear more.
Yep. Now I would say that there is a lot happening behind the scenes to try and get more congressional, get Congress interested in a legislative solution, and kind of holding FDA accountable to make sure that this is actually within their authority to do so, because of course FDA as an agency reports to Congress, and B, to get momentum behind a legislative, a lab specific framework, which has to be passed by Congress for the FDA to implement. We know that's what the FDA is interested in. That is their preferred route. They have said that on the public record, but they're using device regulations because that's what they have. So I think people should really keep their ear to the ground on that as well and get engaged with that effort if they have the opportunity. In the past, I think many have been reticent, I know, because they feel like, well, if we get engaged, we're acknowledging to FDA that they have the authority to do this, and we don't want to do that. Well, if FDA comes out with the final rule, they will have the authority, right? And so and now that will get challenged, but at the same point in time, I think it's going to be really important for people, even if you have mixed feelings about FDA overseeing labs, or not mixed, pretty polarized. I think if starts to be work on a legislative solution, it's going to be important to stay engaged if there is indeed a final rule that's out there.
Yep, absolutely.
Yeah. So yeah, lots going on. And last but not least, everyone wants to forget about COVID, but those of us in testing, and that includes public health, PAHPA, I guess, is the Pandemic All Hazards and Preparedness Act, which was in place when COVID hit and enabled the government to do a lot of things that it did in terms of public-private partnerships, reaching out, things like reaching out to Mayo Clinic Laboratories, to direct testing, all that kind of stuff. That was all, the government was able to do that because this legislation was in place. That legislation expired and needs to be repassed. So right now we're kind of in limbo here, and it goes back to what's all the things that Congress is grappling with right now. Interestingly, though, the current CDC leadership is very interested in continuing to kind of build out those relationships. In fact, ACLA and CDC signed a memorandum of understanding, which is just basically a public statement saying that we do want to collaborate in terms of data sharing and making testing available and all those sorts of things, following both COVID and MPOX. So I think that's another thing to keep watching here, and important, because as we've talked about, just because we just had one pandemic doesn't mean that there's not another one around the corner.
Oh, absolutely. And that's hot off the presses, right, Belle? The MOU with CDC and ACLA. And I would agree completely. We've been talking about the fact that we're going to see new pathogens or re-emerging pathogens. It's predicted on a basis of every 3 to 5 years. We're going to keep seeing things at least coming up again. And that might be Ebola outbreaks from time to time, or something going on in Chicago right now, measles.
Yeah.
And so here we have a vaccine preventable disease. And yet, if you have people that aren't using the vaccine, then it's a highly, highly contagious disease, arguably one of our most contagious diseases. And it has some serious consequences, and it can be fatal. People forget about that.
Yeah, exactly. So yeah, there was a lot of discussion around that, about how do we get testing to contain diseases, and also, get better kind of global surveillance. He brought up there was an outbreak of Marburg, but we just don't have good baseline testing to know if something's truly an outbreak or not. So there's a lot of the ways that we could work together. But yeah, measles is one that's been, I know it got a lot of people's attention, including mine, because there's it's certainly on the rise, and it's been on the rise in Europe and here now in the US. And to your point, it can be a fatal disease. It can have lifelong consequences too, in terms of infertility and other things as well. So
Yeah, absolutely.
really
We're going to be
important.
covering that in an upcoming podcast, so stay tuned on that one.
All right, teaser alert.
Yeah.
So excellent.
Well, thanks for all of those updates, Belle. Lots of things going on, and lots of things in flight. So we will keep everyone updated on what final outcomes are as soon as we hear it.
Yep. Yeah. We'll keep our ear to the proverbial ground.
Yeah. Well, thanks again for joining us, Belle, and I'll look forward to our talk next week.
Yeah, I always look forward to it. So and happy to do it.
Thank you so much for tuning in to Answers from the Lab. Be sure to subscribe to this podcast, and don't forget to tune in every Thursday and every other Tuesday.